us at the IGES Institute. I want to welcome you to today's Corrections Information Sharing webinar. Today we'll be featuring the Hampden County Sheriff's Department Inmate Reentry Exchange. For those of you who are attending our corrections webinars, this is the second now in a series of monthly webinars featuring correction solutions for information sharing. Today I want to introduce Bob May, who's our Assistant Director of Program and Technology Services at the IGES Institute. Bob will be monitoring today's webinar. Bob?
Thank you, Steve. And welcome, everybody. We appreciate you being interested in this exciting project. Today's project, as Steve mentioned, is about the Hampden County Reentry Exchange. It was a project begun with BJA funding in 2010. BJA had asked the IGES Institute, the Association of State Correctional Administrators, Search, and American Probation and Parole Associations to work together to stand up several pilot projects to share corrections information. Hampden County Sheriff's Department was one of those three pilots. The others were Rhode Island Department of Corrections and the Maryland Department of Public Safety and Correctional Services. Future webinars will highlight those projects as well. Hampden County happened to be the first project that was implemented and went live. And today we have John Kinney, the Chief of Security for the Hampden County Sheriff's Department, who will be your presenter to talk about the project today, as well as another information sharing effort that's also occurring in Hampden County that will also be of interest. John has been a lead and key person in this project from day one. So he has a lot of continuity of experience in how this project rolled out. We'll talk about the good and the bad, lessons learned. These were pilot projects, and Hampden County learned a lot, as well as did the organizations that were working with them to implement this exchange that we've leveraged and are now using in current projects, which I'll discuss at the end of the presentation. At the end of John's presentation, we will take questions. We suggest you use the question box on the webinar feature to text your questions at any time during the webinar, and we will ask those of John at the end of his presentation. All of these webinars are recorded and archived, and everybody attending will receive the links to access the webinars or pass that along to others who may be also interested. With that, John, I'll turn it over to you.
Okay, Bob, thank you for the introduction. As Bob had stated, my name is John Kinney, and I've been an employee here of the Hampden County Sheriff's Department. I've just passed 32 years in August. And just to give you an idea, the present slide, exactly where we're at is geographically, we're in the western part of the state of Massachusetts. We're about 90 miles from Boston. Probably about 40 miles from the city of Hartford, which is the capital city of Connecticut, and another 40 miles from the New York State border, and probably about 70 miles from here to the New York capital of New York, which is Albany. A little bit about the present slide. This is our Hampden County Jail and House of Correction. You know, these slides are a little bit older, but today's count is we house 1,431 inmates in our 4 facilities. Presently behind the medium security facility, which I work in every day here, we have presently today 841 inmates. The facility was built in 1992, and once again, it's a medium security facility. We do have high security aspects of our facility, and it's a direct supervision facility. And just to kind of explain a little bit about what that means is that our pods are open. The correctional officer works in the unit. There's one correctional officer to potentially, at the most, 77 inmates. And we encourage our correctional officers to walk and talk amongst the inmates in an attempt to, you know, take a run at them while they're in our facility and attempt to change their ways, means, criminal thinking, and attempt to reintroduce them into society as better people. These are just pictures of our other facilities. We house a regional women's facility, which is in the town of Chicopee, which is about it's about 10 miles from this facility, and it's strictly, obviously, all the women are there. Right directly below that picture is our pre-release center, which is adjacent to this facility, and we have levels of security there, minimum, pre-release, and work release. And to the right, the last picture is our regional alcohol center, which is located in the downtown city of Springfield and the south end city of Springfield. Just a little bit of geographical information. Springfield has approximately 150,000 residents. We also have a neighboring city of Holyoke, which is about 45,000 residents, and the majority of our inmates come from those two urban areas. A little interesting trinket on the picture to the right on the bottom, that's our alcohol center, which is located in downtown Springfield. A lot of urban areas struggling for funding and urban renewal and whatnot. We are in the midst of, and there's been a couple ballot referendums across the state to introduce casino gambling to the city in an effort to revive the income and revive the community surrounding the casino. The slot tables that will eventually be part of the casino are right in the middle of our facility, our regional alcohol center. So we've been negotiating back and forth with the city, with the state, with the Department of Capital Asset Management, and also with the casino people in order to fund to get us an alternate site, which we're making headlines. So a little bit of information on that. That facility was also hit in 2011, June 1st, 2011, by a tornado that swept through here. It caused us to evacuate approximately 220 inmates from that, obviously, community facility with access to the community. We had to relocate them up inside the facility here, and it presented some very unique security concerns in maintaining that level of classification and also maintaining our security levels in here. So just a little bit of information. This is our sheriff, Sheriff Michael J. Osh, Jr. He was elected in 1974. He's the longest serving sheriff in the Commonwealth of Massachusetts. This time last year, the sheriff announced that this present term will be his final term. So he'll be the sheriff through December of 2016. And there's been much speculation and much political activity and people coming out of the woodwork in order to challenge each other to serve the sheriff, who's obviously been in office since 1974. The top picture is a very unique picture because it's taken, it was in Life magazine, it was in Time magazine, and if you look in the background of that picture, you'll see that's our old facility. It was built in the administration of President Herbert Hoover, and at the time of our relocation up here in 1992 to our new facility, we were under a federal cap, and we were letting inmates go 1/3 of their time from a sentence perspective in order to manage the federal cap and manage our population. We were under the weight and direction of an inmate-generated lawsuit, federal lawsuit, that dictated to us that we had to limit the picture on the bottom, obviously, is a more recent picture of the sheriff and his brother, Jay. And what's most unique to this sheriff, and when you speak about sheriffs a lot across the country and the law and order perspective, our sheriff began as a social worker. He began as a foster parent. He once again ran for election in 1974. But our sheriff has an MS in social work from Boston College. And it's been his lifelong duty here to offer the underprivileged inmates that come to our facility the opportunity to change their behavior, and we do that in a very structured, challenging way to get the inmate to try to realize his criminal instincts and attempt to challenge them through a myriad of programs, mental health services, aftercare, and extensive medical procedures and medical care. And our sheriff has always operated under the term firm but fair, and our uniformed correctional officers have that emblazoned on their patch that they wear on their arm. The slide, please. Okay, a little bit about myself, and I had started earlier, and I had said, and obviously this slide is a couple years old, but I finished my 32nd year in corrections. I started in August of 1982, and I was hired at that old facility as a correctional officer. I've come up through the ranks. I've been a sergeant, a lieutenant, a captain. At one point in the late 80s, early 90s, I was the facility investigator. I continued to oversee investigations as a deputy chief and in my present present position as a chief of security. And as is natural, I am the liaison to other criminal justice agencies. And in my career, I go back to the migration of an interest in correctional information from the various agencies. And I can point to a homicide that occurred in the city of Springfield in 1990, where an individual who purported to be a member of the Latin Kings shot and killed a 19-year-old individual or child, really, in the south end, in the north end of Springfield. And the ensuing investigation was really our here in Western Massachusetts, our segue into the world of gangs. We had all read information from the city of Hartford, and I had previously mentioned that's about 40 miles from here, and the Connecticut and New Haven and Waterbury and these places in Connecticut that had these gang situations. But Western Mass was fairly safe from those areas until this particular homicide. And in my career, and at that time I was an investigator, we began to get informational calls, either from the prosecutor or from the police department or from federal agencies. You know, what is John Kenny, an inmate, doing inside? Who is he living with? Who's coming to visit him? Who is he on the telephone with? Who's putting money in his canteen? I can go back. I can probably tell you we fielded anywhere between 25 and 30 calls on a weekly basis for that type of information. And as the time wore on after that homicide, and as the police department and the courts began to deal with this onslaught of gang activity, there was a real interest in correctional information. And I go back to the days, pre-email days, from our technology perspective, where we would fax information. We would go to a meeting with 30 or 40 people, whether they be federal, state, local police officers, prosecutors, probation people, and we would all make, 50, 60 copies of information that we wanted to share. And then you get up at a round table and you go around and speak about what was going on and what you knew. And certainly, even in today's day and age, there's a place for those meetings. I think they bring the ability to network and personalize with people, and I definitely think they are. But that was really the old way of exchanging information from the perspective of my career. And our goal in my presentation today is going to be about our development of technology for information exchange. And once again, those of you who are in corrections, and even those of you who aren't, can recognize the immense information that is collected every day Presently, we have 841 inmates here at the main facility. Every one of them has been processed. Every one of them has had a picture taken of them. Every one of them has had extensive medical history taken. Every one of them picks up the telephone and calls people in the community. Every one of them goes by a certain mind purposes and the like. We collect obviously his name, height, weight, eye color, hair color, scars, marks, and tattoos. And those of you who are in the police arena and correctional arena can certainly recognize the significance of two of those, probably all of them, but two of them are obviously the street name and also the tattoos. A lot of these guys go around and you can talk to one inmate about another inmate, but they'll know them by a street name. Once again, their charges, visits, related people, campaign donations, and telephone calls. All of these things are information, data that we collect in the normal course of our business. Cell locations, mail review. Presently, of the 841 inmates here, I have over 200 of them on a current mail review because they exist within a gang situation, or they pose some type of public safety or high security threat to us in the facility. Intelligence. We are always trying to talk to these inmates, trying to get them to reveal what they know, what they don't know. Occasionally you'll get an inmate that sees the light and he wants to tell us all about his world of crime and what he's been into. And certainly that's a source of intelligence and informant information. So all of that stuff is once again collected in the normal course of business, and it has been since the 1800s or early 1900s when we began the correctional facility. But as I had said before, historically there was an intense interest in this information when it came to dealing with the onslaught of organized gang activity in the community. We looked for a technical solution, and we decided through, and I guess I would point, and in previous talks about this situation, I would point to one particular marquee event, and really it's a marquee event for the entire world, but it was the attacks of September 11th and the establishment of the Homeland Security Division within the federal government. And as we all know, there was an effort to push funding out through the states down to the local level on a myriad of issues, whether it be target hardening, whether it be the ability to deal with a public health emergency. And one of the particular aspects of funding that came was earmarked specifically for information exchange. And Sheriff Ash was selected in 2003 to be a member of the Western Regional Homeland Security Committee, which encompassed the counties of Hampden, Hampshire, which is a little north to us, Franklin, which is a little north of Hampshire, and then Berkshire, which is to our immediate left toward the New York State border. And there was one particular individual, a intelligence sergeant from the city of Springfield, Sergeant Phil Parpey, who he and I kind of bonded, and we had been in a situation where we had been engaged in telephone calls, we had been engaged in faxes, we had all attended the meeting, and we saw the need to develop some type of technical way that we can exchange information, and that resulted in our first attempt, which was just Hampden County alone, which was we called the Wimpson system, as you see the term there, or standing for Western Mass Sheriff's Information Network. And in our greater effort to impact public safety in Hampden County, we centered around those 2,200 sentenced inmates, which we take in, collect all this information on, get this huge history on, and then we release them back into the community. I should say a little bit about the demographics of our facility. We are technically a jail and house of correction, And in Massachusetts, you have two levels of incarceration and sentencing. You have a state sentence, which goes to the Massachusetts Department of Corrections, and that typically is 2.5 years or more. Anything less than 2.5 years would reside in the county sentence, and they be housed locally here in the facility. We also have a pre-trial population, which at some point over the years began to transition to almost a 2-to-1 ratio. So right now we're sitting on 2 times the amount of pre-trial inmates than we are of sentenced inmates. But a little bit about the Sheriff's Information Network. It resides on the CJIS network, which is a secure computer network that is accessible only by people within the criminal justice agency. And it allows the police departments to query our jail database. So I had previously mentioned the data fields and the information that we collect: height, weight, hair color, eye color, first name, last name, street name, or AKAs, time-sensitive releases, releases to a certain zip code, gang information, and scars, marks, and tattoos. So any query of any agency can be a combination of all or part of that. Then I've shown it to different people when I showcase the system, is that if there was a crime committed in the city of Springfield 45 minutes ago, and one of the witnesses had said it was a dark-haired, black-haired person of Hispanic ethnicity with a rose tattoo on their right shoulder. I take him to be about 5'10", 160 pounds, and someone had told me recently he just got out of jail. Well, the police could enter in a time-sensitive range. They could go back to February 1st of 2015. They could enter in all of that data that I previously described, including that rose tattoo. Click it, and it'll give the police department a lineup of individuals that fit that criteria. And we're aware of several important cases in the community that have been solved by information derived from our system. Just to give you an idea of what it looks like, and this is the old version. Once again, we'll get to our hyped up version, but obviously this is the login screen. And I think it's important to note historically that initially it was just us, and that would be Sheriff Michael J. Ash Jr. on the top of the page. But then there was intense interest from the other 3 sheriffs in the western region of the state. That would be Berkshire, Hampshire, and Franklin County. Obviously, this is the main screen. It allows you to select the county on the left, and then add in that information that you're looking for. And what it does, based on your query, is return a list of candidates. You'll see different inmates pictured there, and you'll see their at least initial basic information that you can look at, and you can select an inmate from that you're interested in. You'll see the program will, on the left-hand side, save my recent searches. So if every day I had to go in and search for a certain thing based on changing parameters, it doesn't allow me. I don't have to go in and type. I can just go back and look again and search for the same thing. Once I've selected an individual, and I probably show this guy's face, and more than likely I should probably black out his name, but you'll see this, and this is the initial page you come to, and you'll see his charges listed, you'll see his demographic information, and then the left-hand side you'll see the trees that emanate out that allow us to further drill down on each individual part of the information that we've collected over the year or months or weeks on this individual. One of the things that we try to do here is, and I'm sure it exists across the country, but most correctional facilities, and the term and job as a correctional officer, when you look in the movies or you read your books, or there's not too many TV series or movies about a correctional officer. It's more about the police officer or the FBI agent or some other higher profile profession. And we've always viewed ourselves as correctional officers here on dealing with our own community of lawbreakers inside the facility. And we would encounter situations that are obviously dangerous, but also informative and information. So if you're a correctional officer at 2 in the morning and you notice an incident, or you obtain some information, or you noticed one inmate talking to another inmate, and you file their report, it goes into our system and then potentially can be shared with the police agencies, as you see in this case. There's some media reports, there's some statements in there, and that would be one of the trees that an investigator or a person interested in this person's information can access on the left-hand side of the screen and see. And we've often used that to support our career aspect of corrections. We need good people here. So if we can sell the notion, sell is probably a bad word because I know it's a fact, but I'll go back to that word again. If we can sell the notion that the work that's done here within the facility is contributing to public safety, not only just by keeping them locked up, but also providing them information. I think that's important for our correctional officers, no matter where they are in their careers, to understand and appreciate that they're part of the bigger picture in public safety. So this is an example of information that we share on a daily basis when it comes to officers' intelligence reports and officer incident reports. Once again, visiting information. If I got 100 calls a month from prosecutors or police officers back in the early 2000s or late 90s on who's visiting who, I got 2. It would be a constant. The phone was ringing. And now we put that information out onto the network, and the criminal justice agencies, who's ever interested, can go in and retrieve it themselves. And obviously, we paid somebody to do that for all those years. There was somebody on the other end of the phone. We would have to pay that person to actually print them out and email them or exchange. And obviously, our workload from an intelligence information sharing perspective has really been it's really down to almost zero, because my tip, here's the link and I'll set you up an account and you can absolutely get it yourself. So that's an example of visiting information. Related persons, the people that come in and put money into the canteen account, the people who are on the inmate's phone accounts, his next of kin. There's big interest from a criminal justice-wide perspective in this information when it comes to the fugitive task force people who are out there looking for information on one of our ex-inmates who's in the community, who potentially has a warrant on them. And the information, this shows a historical, anecdotal aspect to who the person is and who he communicates with in his life. And more often than not, the information derived from our system is instrumental in the police ability to track down and capture a fugitive at some point in their investigation. These are telephone records, and within a 3-month period, we staged the telephone information, and this technology, once again, is fairly old. We have the ability to actually share a link with different agencies based on the first issue of a warrant and the like. But this can point a investigator or a police agency in the right direction. In that, on that first page that I had shown, you could query for a telephone number, and you can see who's calling it from the facility. But this gives you an idea of who the inmate called, the time, date, and place, how long the call was, and whether it was successful or not. So that's vital information, once again, that we share and that we allow the police agencies to view. Those of you who have states that have multiple sheriffs in them, each sheriff, of course, is an elected official. Each one has their own, number one, political party, number two, vision and philosophy. And over my 32 years, I've never known the sheriffs in the 16 counties in the Commonwealth of Massachusetts to agree on anything until it came to the value of this information sharing system. In March of 2011, Tony Bryant, my technical partner on this project, we presented to a group of mass sheriffs, and it was so interesting as we were up there presenting. Each one of the sheriffs was shaking their head in the affirmative on the value of this project. So that's a lot. Massachusetts Inmate Data Network, and it now encompasses the majority of the sheriff's departments across the Commonwealth, and it also includes the Department of Correction, which once again is that higher level of incarceration and jail systems that exist in Massachusetts. One of the things that we've encountered on the expansion is that every sheriff's department is not as comfortable as we are in what we share. I point particularly to Plymouth County, which exists out in the eastern part of the state, almost as you would approach Cape Cod. At the time of our expansion, they were housing Whitey Bulger, who, as everyone knows, infamous in the FBI search for him for over 20 years, and they were reluctant to share everything that was occurring with Whitey Bulger, and you can certainly see their point. So as police agencies and parole agencies and federal agencies query their database, they've got to deal philosophically with what that sheriff allows them to see and what he doesn't see. And it's a two-pronged issue, really. It's important that they can retain their autonomy, that they can agree to exchange information up to the point of where they're comfortable. And so that's the good side to each agency. On the bad side, of course, it doesn't allow us to obtain information from them on a prisoner transfer. Therefore, we're still into a fax, email, exchange, phone call information. When we take one of their prisoners, they take one of ours. I know I spoke to Bob, and if we could come up with, earlier I spoke to Bob yesterday, I spoke to a number of people, and if we could come up with funding to build in a third tier. You either exchange all information on one tier. The second tier would be correctional agency to correctional agency in a trusted environment. And then the third tier would be the minimal information, that information that just exists on the face page, that name, date of birth, charges, etc. That would be a goal of an expansion on this information system. Just to give you an idea on the success on it, prior to joining the webinar today, I did a search back to February 1st of 2014, and we've had 7,302 searches, individual searches by individual agencies. The number one person inquiring into the status of information from the jail are the Hampden County District Attorney's Office, which has searched 1,716 times. And the Springfield Police Department, which has searched 916 times. Superior Court Probation, which has searched 632 times. And then just the last one in sequence of numbers is the Hoyle Probation Office, which is 548 times. And anyone out there that is in any way serious about combating crime has to realize that the police department can't do it alone, the probation department can't do it alone, the parole agencies can't do it alone, the correctional facilities can't do it alone, the state police, the FBI can't do it alone. You have to approach this as a team. And so as you see the team approach in Hampden County, one of the big things that we do as contributors of that team is to get our information out there. And as you see by those data statistics, how vital it is. I've often told the story that if technically we had an issue this morning and the system was down, we would hear within an hour that the system was down because someone would try to use it and would be unsuccessful and would report into us that there's an issue. That information system would segue into our reentry exchange information system, which I would like to say has been as successful as our police information sharing system, but I honestly can't say that, so I'm sure that would potentially spawn some conversation here. But as I mentioned previous, the sheriff's background is social work, and he puts a big effort in our whole facility, whether it's the lowest correctional officer to the highest administrator, can repeat the words in verbatim, is that reentry starts from day one. And we put a big focus, whether he's a pretrial or a sentenced inmate, on those criminogenic factors that have brought the inmate here: mental health, substance abuse, violence management, relationships, the ability to exist in relationships, spousal abuse. All of these things are an intense focus on the Sheriff's Department here in Hampden County. We have an intense, behind the walls, in the medium security here, who is either pretrial or sentenced, has to attend mandatory program, and it's all directed based on those criminogenic factors that are identified through our intake process, and it's directed toward individual's personal plan to attack his issues here while they're in incarceration. There's consequences for failure to participate. I'm an inmate and I just want to do push-ups and sit back and put my feet up and do my time. Well, you're going to do it in a Spartan living unit with no television. You have limited access to visits. You have limited access to telephones. And you have limited access with the ability to earn good time, which obviously can shorten their sentence. So that's worked. The inmates don't want to be in that austere setting in a pod. They want to be in a setting within the facility that allows them to socialize and have normal liberties. Just to mention, I had mentioned most of them: GED, life skills, vocational training. And each inmate is required to give some semblance of a 40-hour work week. And that means every Monday through Friday, just like we do, each inmate's required to be up. They have to eat breakfast. They have to get up. They have to make their bed. The correctional officer walks around, and he inspects each cell to make sure each inmates comply. And obviously there is consequences if the inmates don't comply with that edict. We have an intense focus on moving the inmate to lower security. I had shown pictures of those buildings at the beginning of our presentation: the pre-release center, the alcohol center, and our day reporting center as well. That would be where an inmate would wear a bracelet and he'd be out in the community and he'd be subject to either GPS or other technologies to ascertain his location. 65% of our sentenced inmates are released from lower security. Our statistics show that those inmates who are released from inside the medium security facility have a higher recidivism rate than those inmates that are released from lower security. And while the inmate is in a lower security setting, a pre-release, job release, day reporting situation, there's a focus on employment, housing, mental health, and substance abuse. Obviously, from a security, public safety perspective, we do intense drug testing on all these individuals, but our rate of return of those individuals is not all that high. We also established the After Incarceration Support System Division of the Hampden County Sheriff's Department, and it's a walk-in center in downtown Springfield. It's a partnership with community agencies. The issues there we address, once again: housing, mental health, employment, and health care. We recently installed some security down there because you get bad people down there with ill intentions, but you also get some good people down there. So we've done great work, and we've really built that system and that division up from the ground floor, and it's been a big success. And once again, the exchange of information was the same as I encountered on the police side. You know, faxes, emails, signed release forms, meetings with handouts and phone calls. And that's time-consuming, staff-intensive, and redundant. Bob opened up the presentation through some BJA funding and some great work by Search and other agencies, the IGES agency, other agencies. We were able to develop what we call the HIRE network. And Hampden Inmate Reentry Exchange is what the acronym HIRE stands for. And it basically mimics that other system. It allows service providers and social agencies to log in and access inmate data. While the inmate's in incarceration and in interaction with his counselor, he agrees to share information or he agrees not to share information. And the system is built so that we can only share certain information and not share other information. And that data is retrieved from our casework database, which once again is a daily input of data by our correctional staff. This is the front area, the login screen. Both these were built by a Nucor Technology, a New Jersey-based company. You may or may not be familiar with Sharad Rao, the CEO. They were both built, and the initial company name that I'm familiar with is Nucor, but I understand that they're now called Tetris. So, once again, it basically mimics that. It's a first name, last name, date of birth, and a search. It'll return the search parameters on a hit, and it'll display the inmate's graphical information, including, you'll see the top three things: the offender assessment summary, which is a compilation of data that we enter in based on our communication with the inmate. We also we also do that LSI screening, which is the instrument that we measure to identify those criminogenic factors. We also share the TCU drug screen, which is a requirement for our inmates to participate in a funding assistance after they leave incarceration. And we've also taken a run at exchanging medical history, that's been, this whole program has been less than successful. But, and once again, this is an example of TCU drug screen. You may be familiar with it. It's necessary for our inmates to go out and get, once again, that financial assistance to fund any type of co-payments or payments that may be needed for treatment that they may encounter during that vital 60, 90-day period after release. The medical information, once again, just an example of this person's medical information. And these are our providers. These are the social service providers that have signed up and have established an account. Tapestry, Children's Study Home, ROCA, which is a community-based agency that deals with inmates and people, kids in trouble from age 17 to 23. And this is just an example for anyone technically. It allows us to, you'll see the tools that we have available to share certain aspects of the information and to not. So if I didn't want to share behavioral health, for example, or social health, but I wanted to share the TCU screen or the criminal history or the medical health, I could do that, or one or the other, or all. And this is a screen that indicates the number of searches, and this is an old screen. You'll see the parameters. I think I had searched the 6-month period as to users and what they're going in and doing on the screen. So I guess the importance of this screen is the ability for the person sharing the information to monitor who's doing what on the information and to gauge if there's any violations of a trust factor. So that's essentially, and I think I'm 1 minute over, Bob. I'm 2:46. That's essentially our our efforts here in Hampden County. I'm available at any time by this email that's on the screen, and I'd be glad to answer questions or give any type of assistance philosophically. I'm not the technical person, but I understand a little bit of it. But that's essentially my presentation today.
Thank you, John, very much for that. That's excellent background, and having been involved in this project since 2010, it was just a perfect summary of all the activities regarding information sharing in Hampden County and how they evolved. A couple of questions that we'd like to ask you, posed by attendees. What was the biggest challenge in implementing the HIRE project that you guys had to deal with?
Yeah, the HIRE project, and Bob, I guess it would be, and you and I have discussed this and others many times, but I guess it's see, the world that I live, breathe, and work for 32 years has been that criminal investigations and police interaction aspect, and I understand that, and I understand the needs and wants, and I have contacts and people in the community that I deal with. On the higher side, I don't. Obviously, we have people here who do, but I guess the biggest obstacle would be the acceptance, the recognition on behalf of the community agencies that this, number one, exists, number two, that they're interested in it, I guess, interest in it. And it's dumbfounded me for a long time. So. No, that would be it on that question, Bob.
In follow-up to that, John, APPA and the IGES Institute did an impact assessment a couple of years ago, or about a year ago, to talk to both users of the system and potential users of the system who had chosen not to use it. Some of the things that we heard there were that some of the users of the system, such as Providence, felt that the system was very useful for them in aligning their community-based services for offenders coming out of the system. However, some of the people that were inmates that were being assigned to them, they couldn't locate in the system. We later determined that those inmates had not really been fully briefed about obtaining waivers, providing waivers for consent to allow the information to be shared. So that was addressed by educating case managers at the various institutions within Hampden County about the system to make them more aware of it. So I think a lesson learned there was that we can't assume, because we worked so hard developing such a capability, that everybody else knows about it and knows the value of it and does what's necessary to be able to make it more useful. Some of the people,
sure.
One of the other issues that we came up during the whole course of the project was several of the community-based service providers were very small shops that didn't even have computer systems. So when we built the system, we built a portal capability so people without computer systems could sign in from any computer, log in with their credentials, access the information, and then either print it out or back out of the system, and the information would virtually evaporate from whatever computer they used as soon as they closed it out. So it was a secure way of providing information for even those. We have to recognize that's probably not real unusual, that a lot of service providers or small agencies that may not have that capability, or their providers may work in the community and not really in an office where they could access a computer regularly. So we did try to address that issue. Another thing that I think John referenced was just promoting the system in general. When we started the HIRE project, Hampden County invited all of their providers of services to offenders in the community to a scoping session that ASCA, IGES, and APPA put on. And I think we had 33 providers at that meeting interested in hearing about what was going to be going on and if they were, so they could decide if they were interested. And in that session, we identified elements and types of information that they thought would be useful for them to have. And John talked about the kinds of information that the jail had that could be shared. And we also discussed, of course, privacy issues and sharing some of the information. So those requirements were what later guided the development and design and development of the higher technology. And the IGES Institute hired Tetris to be the implementing agency for our organization for the higher program. So I think, but the people involved in reentry from the jail need to be fully aware of the system, its capabilities, and promote its use in the course of their interactions with the community-based providers in this case, to encourage them, including things such as perhaps an open house or other methods to educate them about these capabilities, because if you don't know about it, you can't become a user of it. And I think one of the good things you did, John, was I think you had sort of an open house to kick it off where people would come and be briefed about how to use it and its capabilities, and that's how they got their credentials. And then beyond that, I believe there's a training tutorial, so anybody wanting to get into access to the system can see the tutorial. Is that correct?
Yeah, yes, Bob, but one of the main things is I'm thinking as you're speaking was the length of time between that initial rollout meeting and the actual funding and implementation. I believe it was over a year, maybe closer to 15, 16 months, which I thought that impacted that initial invigorating, intense interest on it, and your typical person would forget about what happened at that presentation downtown at the Sheridan from the actual implementation of the system. So the closer you can have that rollout information system to the actual beginning of the application, I think would make it more effective and fresh in people's minds.
That's absolutely correct, and that is another lesson learned. I'm glad you mentioned that. When this project was conceived back in 2009, we envisioned, meaning ASCA and the other organizations I mentioned and BJA, that we would build this capability and hand the technology to the jurisdiction, and the jurisdiction would implement it on their own. What we didn't envision was that jurisdictions may not be able to afford to implement it or pay somebody else to do the actual implementation of the solution. So during that 16 months, we had, Hampden County had to apply for additional funding to be able to support that, if I'm not mistaken, and that, of course, delayed the process.
Yes.
And as taking advantage of that lesson learned in a future project that I'll talk about in a few minutes, the cost for that implementation part is now part of the grant program, so that won't happen in future grants. So another lesson learned by the pilots. Hang on one second. Let me see if there's another question. Okay, John, I have one question here. Do community service providers have a way to input information into the system so that if a person returns to the jail, the COs can see what programming they've been a part of?
Okay, the system, technically I can't speak to it, but philosophically I can, is that piece of software that we call the Hire has the absolute ability to do that. Obviously, that would involve a build-out on the, say, for example, Bay State Medical Center, which is our local hospital provider here. That would require a buy-in from them, and then certain technical accommodations on their part to push the information out through that piece of higher software, but the system has the ability to do that, and obviously that would be the complete 360-degree solution to an exchange for us to be able to monitor, what went wrong the last time this guy went out, and how can we make it better the next time he goes out. That would be our ideal utopian idea of having a system. But currently the system has the ability to do that, but in actual operation, no, we do not do that.
Thank you, John. And that is another area that we're addressing in the new pilot projects. And if I can take a moment to just briefly talk to people, we have a few minutes left about that. The IGES Institute has another BJA project that we're working on. Since the 3 pilots I mentioned at the beginning of this webinar were implemented, BJA funded the Association of State Correctional Administrators and the IGES Institute with grants to add additional pilot sites and to leverage the technology that was developed for the first 3 pilots into a more useful service specification to share offender information. So we leveraged the technology that was developed in the first 3 pilots. We put together an advisory group of corrections practitioners from jails, state corrections, probation and parole, law enforcement, and providers and major associations to guide that work and identify the data elements that would be valuable to share from point of arrest to release from supervision and everything in between. And a service specification was developed that could be implemented broadly by new sites and new jurisdictions, and then they could implement the exchanges within that they were interested in. They wouldn't have to activate all of the exchanges, but at least they would have a so-called comprehensive exchange mechanism. That project is, that specification is currently finished. It's being upgraded to NEAM 3.0 as we speak, and we will be implementing it and actually have begun implementation in Illinois, Iowa, and Tennessee Departments of Correction the rest of this winter and early spring. So we're pretty excited about that. A lot of lessons learned from the first pilots are being leveraged in this process, and John Kinney and representatives of the early pilots were a part of the planning of all of this that I've discussed. So we will be talking about those projects and the other 2 pilots in future webinars as well. Real quickly to wrap up, the next webinar will be on March 18th from 2 o'clock to 3 o'clock Eastern Time, and will feature the Alabama Secure Sharing Utility for Recidivism Elimination, known as ASSURE. It's a project of the Alabama Department of Mental Health, and it targets the lack of information sharing relative to offenders' substance abuse and mental health diagnosis and treatment histories, and shares between the Alabama Department of Corrections, the Board of Pardons and Paroles, the Department of Mental Health, and community-based substance abuse mental health treatment providers. The goal, of course, is to provide continuity of care for persons with substance abuse and mental health issues for offenders under probation supervision in the community and for those released from ADOC into the community. The webinar from January was on the Pennsylvania County Commissioners Association's Unified Case Management Program. All webinars will be at the same link on the IGES website, and all registrants for this webinar will receive announcements of future webinars, and which will include the link to the archived webinars as well. If anybody has any information or requests additional information or needs assistance accessing those, please use my email address to contact me, and I'll be glad to help you with that. I want to again thank John Kinney for taking his time today to share the Hampden County Information Exchange with us, and wish everybody a wonderful afternoon. This concludes the webinar today. Thank you very much.